I'm so thankful that we talked about my mother's healthcare decisions before the doctors told her that the cancer had spread. She chose to do the chemo and radiation treatments, but she also made it clear in her advance directive when to shift the focus to keeping her comfortable and not pursuing every possible drug treatment.
None of us likes to think about being unable to make our own decisions. That's why it's important to think about and talk about our feelings and beliefs with those we're closest to long before critical decisions must be made. It's your right to plan for your care. An advance directive is a legal document. It is written before a medical event occurs. The advance directive allows you to designate another person to make healthcare decisions for you. It's a good idea to have an advance directive in place to give your healthcare providers and people closest to you the confidence to follow your wishes for care.
My brother was in an auto accident. It was so difficult for his wife and our whole family. He was put on life support, but the doctors told us he would never regain consciousness. His wife didn't think he would want to live like that, but my parents didn't want to stop the life support. We had never talked about this kind of thing. We didn't know what he wanted.
Making decisions about medical care is not always easy, especially now that machines can keep patients alive when there is no hope for recovery. Having an advance directive and a durable power of attorney for healthcare will make it much easier for your family should you become unable to participate in decisions about your care. They will not agonize or be uncertain about your wishes. If family members or healthcare professionals disagree, an advance directive can avoid decisions being made by a court, which can be difficult, time-consuming, and costly. A durable power of attorney for healthcare, or DPOAH, is a part of the advance directive document. It allows you to name another person to act as your healthcare agent and make medical decisions for you if you become unable. You can include instructions about which treatments you do or do not want and how long you want to try possible treatments. If you do not want medically administered feeding or hydration, New Hampshire law requires that you say so in your document.
My neighbor Jill, who lives across the street, had a stroke. She was smart because even though she's not married, she had talked about advance directives with her family. The doctors at the hospital knew who to call when decisions needed to be made about her medical treatment.
Talk with those closest to you, a spouse, parents, siblings, children, or a close friend about what would be important if you were unable to communicate your medical decisions and who you would want to make choices and speak for you. To learn more, visit healthynh.com, where you can get information on how to complete an advance directive. Be sure to share this information with the person you designate to speak for you if needed. You will also want to give a copy of the advance directive document to your doctor and other healthcare professionals.